Yeah, I'm so glad that you asked this question, and I'm sorry that it's just taking me a while to get back to it. I've been trying to get through some birth injury investigations for some clients, and I got to prepare for a court hearing tomorrow. But again, the question is, what is HIE? HIE is hypoxic ischemic encephalopathy, and in our context, that's going to mean a reduction of oxygenated blood, which can lead a baby to suffer a traumatic brain injury. It is a type of traumatic brain injury. Now, the next question may be, okay, well, then Marcus, okay, what can cause something like this? There can be a lot of things which can cause a baby to suffer an HIE injury. In some instances, you may have genetic challenges which may lead a baby to suffer a HIE injury. You might have developmental challenges which may cause a baby to suffer a traumatic brain injury. And you can also have the third way is you could have, in other words, in essence, negligence during labor and delivery, which can lead a baby to suffer a traumatic brain injury. And that negligence can either be the doctors and nurses or the hospital. Now, I'm going to go a little bit further, and I'm going to help you understand two areas of concern if you think a baby may have suffered a possible traumatic brain injury like this. Number one is going to be seizures. If a baby has suffered seizures either immediately after birth or a couple of hours down the line, if they suffered seizures, there's a strong argument that can be made that the baby has suffered a type of traumatic brain injury. The second thing I want to talk about is a lot more technical, because it gets to the umbilical cord gases, the cord gas reports. And if you have on your own went out and got your medical records, got your medical records, got baby's medical records, got the fetal heart script, if you look in the baby's records, there should be, if there has been a suspected brain injury, there should be umbilical cord gas readings. Now, different hospitals and agencies, they may have a different range for what these readings should look like, but if you have an umbilical cord pH that is 7.1 or lower, then that's a strong argument can be made that an acidotic event happened during labor and delivery. In addition to the cord pH, you may have the base excess numbers and the base deficit. So these types of numbers can also help understand whether a traumatic brain injury may have occurred. And again, going back to the cord pH, generally if you've got numbers within about 7.2, 7.3-ish in that range, the defense is going to argue that nope, there's no way that the doctors, the nurse, or the hospital caused this injury, because the gases are in what we would call the normal or semi-normal range. So I know it was a lot that I talked about in this video going off of the question of what is HIE, but I hope that this is giving you a lot more insight into this issue. Talk with you next time.